Important notice. This video is provided for informational and educational purposes only. It does not substitute professional medical advice. Today, we will address an important topic that many people face but few talk about: the signs and symptoms of stomach worms and their treatment. Recognizing these signs is essential to seek proper treatment and maintain good health. If you are new here, be sure to subscribe and enable notifications so you don't miss any important content. Stomach worms are parasites that can cause a series of uncomfortable symptoms. They can affect people of all ages and are more common than you might think. Let's understand what the most common signs and symptoms are so that you can identify them and seek medical help quickly. Stay until the end of the video to understand better. Stomach worms are parasites that lodge themselves in the human digestive system, including the stomach and intestines. These parasites can be of various types, such as nematodes, cestodes, and trematodes, and are generally acquired by ingesting contaminated water or food, contact with infected feces, or through the skin. Once in the body, these worms can multiply and cause a series of uncomfortable symptoms, affecting the health and well-being of the infected person. Recognizing the signs of a worm infestation is crucial to seek proper treatment and avoid complications. Signs and symptoms. 1. Respiratory problems. This occurs because some types of parasites can migrate to the lungs, causing cough, shortness of breath, and other respiratory symptoms. The presence of these worms can irritate lung tissues and decrease respiratory capacity. If you are experiencing breathing difficulties without an apparent cause, it is crucial to seek medical evaluation to identify the possible cause. 2. Diarrhea or constipation. One of the frequent signs of stomach worms is the presence of diarrhea or constipation. Worms can interfere with the absorption of nutrients and water by the digestive system, leading to imbalances that result in diarrhea or constipation. Diarrhea may be accompanied by watery and frequent stools, while constipation can cause difficulty and discomfort during bowel movements. These intestinal changes are an indication that something is affecting the normal functioning of the digestive system and require medical evaluation to identify the cause. 3. Loss of appetite or increased appetite. Some people may experience a significant decrease in appetite, while others may feel a sudden increase in hunger. These changes may occur due to the interference of worms in the digestive system, affecting nutrient absorption and causing abdominal discomfort. Loss of appetite can lead to malnutrition, while increased appetite can lead to excessive food intake without adequate weight gain. If you notice these changes in your appetite, it is important to consult a doctor for evaluation and proper treatment. 4. Pale or yellowish skin. Pale or yellowish skin can be a sign of stomach worms. The presence of these parasites can affect the absorption of nutrients, such as iron, which is essential for the production of red blood cells. This can lead to anemia, characterized by a reduction in hemoglobin levels in the blood, resulting in pale or yellowish skin. If you notice any changes in your skin color, it is important to seek medical advice for an evaluation. 5. Abdominal pain. One of the most common manifestations of the presence of stomach worms is abdominal pain. This pain can range from mild to severe and is usually located in the stomach or abdomen. Worms can cause irritation and inflammation of the lining of the stomach and intestines, leading to abdominal discomfort. In addition, the presence of worms can cause intestinal spasms, which intensifies the pain. If you experience persistent or recurrent abdominal pain, especially if accompanied by other symptoms, it is essential to seek medical advice. 6. Nausea and vomiting. The irritation caused by worms in the lining of the stomach can trigger feelings of nausea, resulting in nausea. In addition, in some cases, worms can cause obstruction or inflammation, which can lead to vomiting. These symptoms may be intermittent and worsen after meals. If you experience persistent nausea and vomiting, it is important to seek medical advice for an evaluation. 7. Itching in the anus region. Itching in anus region is a common symptom associated with the presence of stomach worms. When worms migrate or lay eggs in the anus area, it can cause intense irritation and itching. This sensation can be especially uncomfortable at night, interfering with sleep and overall well-being. Persistent itching should be a cause for concern and requires medical evaluation to identify the exact cause. 8. Muscle and joint pain. These symptoms occur due to the body's inflammatory response to the presence of parasites, which can release toxic substances and trigger an immune reaction. The pain can be generalized or localized in specific areas of the body, affecting mobility and physical comfort. The feeling of stiffness and difficulty in performing simple movements can be an indication of parasitic infestation. If you experience these symptoms along with others mentioned, it is crucial to seek medical advice for an accurate diagnosis and an appropriate treatment plan. 9. Fatigue and weakness. Fatigue and weakness are frequently reported symptoms in people with stomach worms. The presence of these parasites can interfere with the absorption of essential nutrients by the body, leading to a state of constant fatigue and muscle weakness. The lack of energy can affect daily activities and the individual's quality of life. It is important to be aware of these signs. Treatment. 1. Antiparasitic medications. These medications are frequently used to treat stomach worm infections. Antiparasitic medications are formulated to combat and eliminate parasites present in the digestive system. They work effectively to interrupt the worm's life cycle, helping to reduce the symptoms associated with the infection. It is important to follow medical guidelines for the correct dosage and duration of treatment, thus ensuring the effectiveness of the medication and the patient's complete recovery. In addition, it is crucial to have medical follow-up to evaluate the effectiveness of treatment and ensure that the worms have been completely eliminated. 2. Balanced diet and hydration. A balanced diet and proper hydration play a crucial role in treating stomach worm infections. A diet rich in essential nutrients helps to strengthen the immune system, making it easier to fight off parasites. In addition, consuming healthy and varied foods contributes to the body's recovery and improves digestive health. Hydration is equally important, as it helps to eliminate toxins and waste products from the body, aiding in the proper functioning of the digestive system. Drinking enough water also helps to soften stool, making it easier to pass and reducing the discomfort caused by worms. 3. Personal and environmental hygiene. These are important measures for treatment, especially when combined with other therapeutic methods, such as antiparasitic medications. Washing hands frequently with soap and water helps to prevent the spread of parasites and other infections. In addition, keeping the environment clean and free of animal waste and debris reduces the risk of contamination. It is also important to wash fruits and vegetables before eating, avoid close contact with potentially infected animals, and clean shared spaces regularly. These simple measures, when adopted regularly, contribute significantly to the recovery and prevention of new stomach worm infections. If you found this video helpful and know someone who could benefit from this information, don't hesitate to share it. And if you have faced this problem before or have any questions, leave them in the comments below. Let's take care of our health together. Don't ignore the symptoms and seek medical help for an accurate diagnosis and proper treatment. Until next time.